thing is about this dementia is that there's this feeling that's very general that people think it's the most horrendous thing that happens to them. It doesn't need to be at all. I've discovered over the last few years, since I got a diagnosis, that there's lots of things that we can do that we think will slow it down. To get the exercise for the brain, conversation, socialising, that sort of thing is really good exercise for the brain. So I recommend to people, don't withdraw and go on a sofa and watch the TV and that sort of thing. Get your brain working, keep active. Not just physically, but mentally as well. This is what I try to do all the time.
There's lots of treatments that are available. There's medications that can be effective in some people, but not in everybody. But there's also access to different support systems and treatments that can be available. I think there's still a very big stigma attached to dementia and Alzheimer's disease. But I think the thing to remember is that it's a condition and it's an illness, and like lots of other illnesses, there's support and treatment that can be given. In Bolton, there's a new memory assessment service that has been developed, and that is looking at increasing people's diagnosis rates. That somebody would need, right from diagnosis to more complex elements of care, can be found within one guide, and all the support that's out there in Bolton is detailed within this guide.
We listen to people and take their ideas forward, and that's very much what the ethos of the Reach Beyond service and the Open Door service is, really, that we can learn from people's experiences and maybe try and, cross those gaps between services as well.
In Trafford, we have developed a new InReach service. What InReach does is it aims to, rather than bring somebody into hospital, it aims to provide support and treatment for that person in their own home or in a residential home. Nationally, we know that only about half of people with dementia actually get a diagnosis. I think the national diagnosis rate is 46%. What we're looking at doing, and what one of our main aspirations are for this coming year, is to increase our current diagnosis rates across all three services.
People have to understand that a diagnosis doesn't mean they've changed their life. In fact, it's on the contrary. It's a case of whatever you do, keep doing all the things that you're used to doing, but more so.